Hi, my name is Karen. I'm going to be taking care of you today. What's been going on?
I feel like I can't breathe.
Has this ever happened to you before?
Once or twice, but it wasn't this bad.
Do you have any significant medical history?
I don't know. My doctor said I have diabetes, but I don't know what that means.
Do you have any cardiovascular problems in your medical history?
I had a small heart attack about a year.
Were you hospitalized for this heart attack?
Just for a few days.
Were you prescribed any medications or healthcare regimens to follow after this happened?
I don't remember.
What meds are you taking at home?
I don't take any. They're too expensive.
Okay, we'll talk about that later. What kind of foods do you eat?
Well, I like Wendy's or ramen because I can't cook, so I usually just microwave or go buy something.
Okay, do you smoke?
Only a pack or two a day.
How long have you smoked for?
Not long, like 30 years.
Okay, any alcohol use?
Only when I'm feeling frisky.
Okay, I'm gonna take your vital signs. Alright, I got 180 over 132. What's your normal blood pressure? Is it always this high?
I don't know. Oh my god, my left shoulder really hurts, and now I really feel like I can't breathe.
The pain just began suddenly? This was not occurring when you first got here.
No, it wasn't. It just started.
Is the pain just in your left shoulder?
No, it's on my chest too. There's a lot of pressure and tightness.
Are you still having this pain as we speak?
Yeah, I would have told you if it stopped.
What does the pain feel like?
I don't know, like a crushing and like something sitting on my chest.
Is there anything that makes the pain less?
Well, I've had it before and my sister gave me pills, but I really don't know what they were.
Is there anything that makes the pain worse?
Yeah, when I move and when you keep asking me these stupid questions.
Alright, I'm gonna go talk to the doctor and have him come down to see you.
Fine.
Hi Esther, my name's Paul. I'm gonna be taking care of you today.
Hello.
Who's that?
Oh, this is my sister Trudy. Trudy, say hi.
Hey,
It's good to meet you, Trudy.
nice to meet you, Paula.
Okay. How are you feeling today, Esther?
Oh, I'm just peachy.
Okay, well that's good considering the condition you arrived in.
Well, what's that supposed to mean?
A lot has changed in this past week. You had a coronary artery bypass graft, right?
Yeah, I remember.
Okay, your troponin level has improved significantly.
Well, I guess that's good. Heart attacks happen all the time though, right?
Not usually in healthy adults. Lifestyle and smoking directly affect the possibility of having a heart attack.
Are you calling me unhealthy?
I'm just concerned about your lifestyle. We need to work on making changes to improve your heart health.
Well, what do you think I should do then?
Well, we can start with smoking cessation.
Well, I've been smoking for 30 years, and my sister and I smoke together. It's sisterly bonding. You can't expect me to just quit tonight.
Okay.
By the way, when can I go out and have a smoke again? I've been asking for the past, 3 days.
Do you want to quit smoking?
Well, I mean, if it's the only option I have, then I guess I have to.
Okay. I'll order you a consult with respiratory therapy to discuss smoking cessation options.
All right.
Do you have any other questions?
Yeah, do I have to change my diet now?
Well, sticking with a low sodium and saturated fat diet will help your heart conditions, and following a consistent carb diet with your diabetes will be beneficial too.
Can I at least have one last Wendy's burger before I go on this stupid diet?
Well, why don't we take a look and see what's in a Wendy's burger to see if it will fit in your diet?
Okay.
Well, a double stack has 25 grams of carbs and 1,070 milligrams of sodium. And
Well, that's not that bad.
well, with your diet, you should only have about 2,000 milligrams of sodium a day.
I guess if that's the only thing I eat, though.
Well, that wouldn't really be good for your diabetes.
All right.
I told her no more Wendy's.
That's good for you, Trudy.
Well, she eats it with me. Who's she kidding? If I'm going to do this, then you have to do this too.
I'm not the one who had a heart attack.
Well, you're going to if you keep eating the way you do.
Esther.
Hi. So Trudy and I talked it over, and I guess we decided that quitting smoking and eating healthier would probably be a good decision for both of us. Not just me, but both of us.
That's really great, Esther. I'm glad you came to that conclusion.
Yeah, thank you for your help. You've been very nice. I like you the most.
Oh, thank you.
You're such a good nurse.
Thank you.
Hello, boys and girls. Welcome to the School of Cardiac and Peripheral Vascular Assessments. This is Claire Coulter, my lovely model, but you can call her Claire Bear for the time being. I'm Lauren Porter. I'm be the nurse today. So what brings you in today, Claire?
Chest pain.
Oh, chest pain. So the first step of cardiac and peripheral vascular assessment is to old card that pain. Claire, what is the onset of your pain?
It was about 9 o'clock this morning.
Okay, so that's about 35 minutes ago. Where's the location?
Right above my heart.
Okay, so that's some serious chest pain. And then what's the duration? Does it come and go, or is it constant?
It's pretty constant.
Constant for that full 35 minutes? Okay. And then what are the characteristics of this? Is it sharp, shooting, dull?
It's a little dull and achy.
Okay. And what aggravates it?
Moving around.
Okay. And what relieves it?
Just kind of trying to sit and breathe a little bit.
Okay. And did you take anything for it?
I have not.
All right. So now that we got that covered, I'm going to grab a set of vitals. So I'm going to listen to her heart, and I'm going to throw a blood pressure cuff on her. And then after I do that, I'm going to check her pulses. Nice and strong. That's the way we like it. And we're going to move down to the feet. You can do the femoral if you're feeling fancy. Okay, so everything's strong. So next, well, you probably do it as you went along. So you would do cap refill, make sure you're getting enough perfusion. I don't think she's perfusing that well on her feet. They look a little necrotic to me. How long have you had that necrosis?
Oh, about 2 months.
Oh, have you seen anybody for that?
Oh, no.
Okay. So next step is you look at the extremities. So you're gonna look for edema. You're gonna look for hair. Claire, do you do laser treatments?
Don't do laser treatments.
Okay. All right. And then you're gonna look for obvious necrosis, and as you see, this is all necrotic tissue. So, a little ditty to remember: the all pigs eat too much is how you remember aortic, pulmonic, herbs, two, tricuspid, much, mitral. So, you're going to take a little listen. You're going to hear a nice lub dub. Sounds good. So that's about it. I hope you learned something today.